be better suited
Currently,
by
if we
people
do
who've
it-
been involved.
Well, my plan was actually, it probably wasn't gonna finish tonight anyway, so I was gonna
Okay.
span it over 2 times. What it'll turn out doing if we started, and we can still start, is we'll just do the whole thing over, or just move a little faster. Maybe it'll take us 3 times to do it. So, at any rate, where's the agenda? Somebody can please do it. So, well, since we're a smaller number, but we have at least 1 or 2 more people, why don't we just take a minute and introduce ourselves and organization we came from, just so everybody hears our ones. Karen, you want to start?
Hi, I'm Marion. I'm the coordinator of Community Health Initiative, the Urban Health Institute. I'm Tamika Sam, a postdoctoral fellow in the General Institute.
I'm Lisa Williams. I'm the director of the City Medical Society.
Angelo Solera, Executive Director of the Latino Development Network.
I'm Elizabeth Dorr. I'm the Associate Director of SOURCE, Student Outreach Resource Center, Community Service and Service Learning Center for the Health Professions Group.
I'm Liz Toft. I am the program coordinator with the Urban Health Institute. And I'm taping, that's why I'm being antisocial.
No, that's right, I forgot. So we video all of these, not for the purpose of blackmailing you, but we try to put everything up on the internet for those who can't make it to our meetings and for others who want to know. And Ernest is on the phone. I'll let him introduce himself when he comes back. And I'm Chris Gibbons. I'm one of the associate directors at the Urban Health Institute. And I run this community health institute. So, as most of you know, we have been involved as a result of our talk, just for a short bit of background for our newest guest. We've been working together for about 4 years now, from the very beginning. We've done a lot of planning, a lot of talking. We're in the process now of conducting a community in East Baltimore community assets mapping project. A lot of urban places where there are a lot of blight. Nobody believes there's anything positive or worthwhile in those places. And so this group thought it to be important that we do that. We've actually gone out and talked to, I can't remember the number, 175, 160 people, and we're going to be talking to at least 25 or so more, particularly in the Hispanic community, to do this. And then we're right now gearing up to analyze the data and then be able to catalog it for the purpose of then saying, hey, this is what's out here, these are the resources, be they people, businesses, whatever, that can be part of solutions, that can work with us and work with Hopkins and work with whoever around improving health in East Baltimore and change that model from always paying the experts from outside only to come in and tell those people what to do, go back home paid and nothing ever changes. So that's the bottom line idea. That the update for those of you who have been here is that we are very close now to being ready to start hiring, or we're in the process of hiring 2 community folk and 2 Hopkins students to do the coding. That's the first level of analysis of the data that we have already. Just before we go on, Ernest and our guests, you want to just quickly introduce yourselves to everybody so everybody knows who we are?
All right, my name is Ernest Smith, and I'm with the Monument to John B. Fayette Revitalization Group that is located in the area just east of Johns Hopkins Medical Campus.
Great. My friend?
Yeah, my name is Ola, and I'll be working with the other coders from the Bloomberg School of Public Health.
You're working with who?
The coders that will be working on the coding.
Coder, okay, you're going to be one of our coders. All right, we were just talking about that. Great. So you're a student at Hopkins. Great. So this is Ola. We have many students in and out of the process. Ola is one who's. I was just mentioning the fact that we are in the process of identifying and hiring. I think Ernest is one of our community members that's going to be working. And Tanika, are you? Tanika is another student fellow faculty person that's going to be a coder. And the fourth one, I think, is Roxy. Roxy, that's right. She's not here. So, and there may be actually, there's actually probably going to be one more. But those are, it took us a while to find the right people and get them through the process. And I'm understanding we're almost through the hiring process and all that other stuff. So we're looking to try to start, I believe, with the training. First, we're going to have a training the next week or two, is what I heard last. I don't have any dates yet, but that's where we are. Hey, have you heard anything different?
So trying to set up the dates.
Right. So, and again, just to fill everybody in sort of on the process of analyzing interviews or qualitative data. Hey, Bob, you just want to quickly introduce yourself? We have one or two very, very new people here.
Hi, I'm Bob Walker.
And my friend who's getting food, well, he gave it here. So there's one other new person that I don't want to anyway. So just again, for the really, really new people, the process of analyzing interviews, which is qualitative data, involves a process. All those interviews were recorded and they were transcribed. Now you go back and look at the transcriptions and pull out themes, and that's what the coders do. They look through and say, you know, are there themes in here on any of a variety of things? Pull them out, categorize them, and then we'll have them, and then it's our job collectively, everybody, to look at them to see if we can make meaning from them and see what we learn about assets, which is the whole purpose of the course. So we're almost ready to begin the coding in the next week or so. So that's the update on the coding. What we wanted to do, we felt that while it was taking a little time to get ready for coding, my friend, you want to just introduce yourself right quick?
Yeah, my name is Jonathan Leo. I'm a medical resident in the Hopkins system.
Great. This is your first time with us or no?
Second time.
Second time, good. Great. So as everyone knows, we've been working a little bit we finished most of the interviews. We're now going into the coding and analysis phase, but that doesn't leave, at this point, a lot for everybody else to do. And so while that's going on, we felt that, at the recommendation of some of you, it was a good time, we hadn't done it yet, to pause and to review, reflect, and maybe refocus and chart our course, or begin to chart our course for the next year, and to see where we are. So what we'd like to do tonight is start, probably will not finish tonight, we definitely won't finish tonight, but start a process of self-reflection, self-evaluation, which will be open to all of us, and we will all participate in, and chart our specific objectives over the next 12 months. That sound reasonable? Yeah? So what I've done to just start the process going is to put together some slides that have my thoughts, or our thoughts at the Urban Health Institute about what we've done, and we'll go through them, but they're only a starting point, and the whole discussion will be, are there more things? Are those the right things? Should some of those things be pulled off or not? And one of the things I wanted, though we didn't get to bring it, was note cards for everybody. If we can use some of the papers that you're handed out, we won't have time to discuss everything. So if there's a thought or there's something that you want to say that you couldn't say, please write it down on a piece of paper and give it to Liz or Marion or myself. So, because we want to make sure we get everybody's thoughts, everybody's ideas in this discussion format, and we just, we may not have the time. So why don't we start? Is the lights too bright? Maybe we can turn down the lights a little bit, but it's okay. All right. Okay. So here's where we're going. Oh, when we're done with this, not tonight, but when we're done, these are the questions we're going to discuss among ourselves and answer, where have we been, essentially what have we accomplished, what are we doing now, clear about that, where are we going, what are we going to do, that's ultimately the bottom question, where we're going in the future. What are things that we have been doing really well? I mean, we've been a group now for 4 years. What are we doing well? What are some things that we're not doing so well and we need to improve on? How should we track and evaluate what we've done? We've sort of been a little loosey-goosey about that. And I feel, as you'll see, and I think you feel, we have something good here. And part of being good is being able to say what is good and how we can get better in the future. So we got, I think, you tell me what you think, we got to track some things better, we got to evaluate better. I'm interested in your thoughts. How can we improve how we communicate to others about what we do and what we accomplish? Some people know about us, a growing number of people know about us, but not enough. How do we get the word out more? And at the end of the day, what difference does it make anyway? We can be doing good things and feel good about ourselves, but if it's not making any difference, why should we be doing it? And finally, what are our priorities for the next year? So that's kind of the roadmap. Anything anybody thinks is missing out of that? Something we should put in there? No? Not really? Okay. So I really want this to be discussion oriented, so let's just get it. Only requirements, your input. That's the only thing about all these things, and not just tonight, in the future, through all those means, and it's not the only thing we'll be doing, we'll be contacting you for other things, but your input. All right, so let's get started with the topic. Where have we been? Essentially, what have we accomplished? And I must be honest, before I started to actually write down these things, I figured a few things. When I wrote them down, I really said, wow, to myself. But these are the things that I think about. And I'll just run through them and then we'll come back and talk about it. We formed and proven to ourselves now that we have an enduring collaboration. We've hung together for 4 years. Many don't do that. We have agreed collectively on a mission for ourselves. We've agreed on operating principles, developed core values. We had a long process of developing those core values ourselves. We've begun to establish a mutual trust, decided on priorities. We've started several work groups. We've developed what I think is a valued process of community academic engagement. It's valued, I hope, by you, I think by you, but it's certainly valued by others at Johns Hopkins, and we can talk about that. We've begun to engage community members directly with Hopkins leadership, something that may have happened in the remote past, but largely to my knowledge wasn't happening at Hopkins within the last maybe decade. We've strengthened other people's collaborations through the work that we're doing here. We've initiated some community-oriented health projects, the asset problem and health opportunity project. We'll talk more about those. We've actually provided some community members jobs, and there will be more. We had hired 8 data collectors, plus Marin and Tara to work on that project. We're hiring a couple more for the analysis, so it's a start. These aren't full-time, forever permanent jobs, but they were jobs, real jobs that paid real money, and I think that's important. I think that's a starting point. And I've heard, and you tell me if you've heard, but I've heard from some of you that you've learned more not only about each other, but you've learned stuff about Hopkins, and I'm clearly hearing from Hopkins faculty, from staff, from leadership, that they learned a lot more about the community, about doing this kind of work, and I think that's a good thing. I think those are, all right. So, what do you think?
One thing that wasn't up there, and I'll have to say that was something that was greatly appreciated, is the capacity building component.
Capacity building.
Yeah, because out of this, individuals began
Where are you taking notes for us?
began to learn about capacity building, such as the grant writing workshop, some of the communication workshops.
So, would you call that more Urban Health Institute, or is that us, or?
Well,
We'll take the credit.
I mean,
we'll take the credit. Good.
You know,
Okay.
but it's but
It is.
it got there because of
That's
what
true.
we do
That's
here.
true. That's
And
true.
the need, and so
Okay.
one of the partners within this group said, hey, you know what?
That's true.
We can do that and open it up to all of the members of
That's true.
this initiative.
So when you're talking capacity, you're talking about the grant writing works, anything else in specific?
Right, the grant, because we did a grant writing workshop. We also did the one that I thought was most important is the evaluative process, the one on
The
evaluation.
asset, that went with the asset mapping?
No, there was an actual training on, I'm trying to remember the instructor.
What was that about?
Christian Martin.
Yes.
Oh,
and
okay.
She actually
Okay.
did the,
That's right.
the evaluation, or how to do the evaluation, develop the evaluation process for a grant.
That's right, excellent, excellent. Good, good.
So,
Anybody else that's been with us, think of anything
I
that?
think that for me, it, I also have some concerns, but for
Yeah, yeah.
me, one of the most extraordinary experiences was the experience of 6 people from Hopkins and 6 people from the East Baltimore community meeting week after week after week, not once a month,
Right,
but every week
That's right,
to put together an instrument.
that's right.
When the community folks said using external consultants doesn't fly. We want to craft it ourselves.
Right.
In that process, I only wish there had been a camera to
Yeah.
capture it,
Yeah,
because
that's true.
for me, it was one of the most powerful experiences that I have had as a researcher. And being able to sit in the Ardmore, Ernest was there every week, and that it really represented culture.
So for those of you who may not know, a part of getting ready for this asset mapping project was to decide what we wanted to know, what was important, how were we going to engage people, what were we going to ask them. And of course you can pay researchers and instrument developers to do that, but this group said, no, we could do that. We had gotten some training on things, so we could do it. But it took, as Bob said, a group of 12, or roughly 12 people, half from the community, half from ours, sat together for a period of about 6 or 8 weeks, something like that, and really hammered that through and developed a high-quality instrument that I think is, as Bob said, a model. I don't know what you call that, but that working together definitely was a good.
it was interesting.
Yeah.
We're good.
Anybody else, any thoughts? Anything that I listed that you think shouldn't be there? And it's okay, again, we're gonna be talking about these more and more, and if you think of something tomorrow, email us, just make sure. What is it? You wanna say what it's thinking? That's the first sentence. I mean, for those of you that were there, or those of you that have done this or know about this, making an enduring collaboration is not an easy thing. I mean, if you've been a part of this before, how many of you have been a part of one that started that are now not functioning? And we're not paying everybody. You know, we're not begging people either. You know, it's going on its own. So I think that's really something. It took us a while to agree on a mission. It was a process where we talked about, we argued about operating principles. You know, what are they for? What are they? Mutual respect, openness, civil dialogue. Forget the last one. Core values. How long did it take us to do those? several months,
Yeah.
Matter of fact, everything else stopped that we were working on because there was both interest but intense passion, argument, whatever you want to call it, about what are we about and what are we going to demand of ourselves in interacting with each other and demand of others who want to interact with us. That was not easy. Trust, priorities. Yes. Oh, sorry.
So I think this speaks to both this idea of the enduring collaboration and also the mutual trust. I would consider it an accomplishment if people actually felt that this was in fact the case, but whether they felt the partnership was in fact effective. I sort of feel like it was, although perhaps at times I think it was a feeling that it may not have been.
Yeah.
But I think if, as a collective, we sort of feel like overall people can voice their opinions.
And when it wasn't, we've changed it or improved it, is that what
Right,
you're saying?
yes, and I would consider that.
So not just a partnership or an enduring partnership, but an equitable.
But that could, where everybody has it.
What do you guys think?
I would want to add something else, and what I want to say is...
Hold on one second, just before you go there. Do others agree or disagree with Tanika?
Yeah, that was
Great.
a key point.
Okay.
Why this thing keeps going.
Great. I'm sorry.
So I was going to add that not that what I'm going to say means that things will not accomplish, and I think that putting something together like this, it takes a lot of work.
Yeah.
4 years of work and bringing people together and making something like this happen, it takes a lot.
Of course.
But coming lately and looking at what has happened and realizing that the whole community was missed. There is no representation of the community that I represent within this Baltimore community. And looking at this, I was disappointed in the fact that I know things are changing now and we're looking at some things and possibilities, but the fact that so much energy was put to create this, and yet there is a big hole.
Yeah.
And I think that probably could be...
So can you, I'm not trying to cut you off, but we're definitely going to talk about places we didn't do things right, we need to do better, and I think that fits squarely in there. And there's no way trying to rush it into the table like that.
So we cannot.
Right.
That's
Right.
one that we all recognize.
Right. Let me just show you the second.
Yeah, what's
list.
page 2?
Yeah, these are the, so this one, I'm not sure.
So let me say, the thing that I wonder, that I would put a question on, is not the equitable part, but is the enduring part. And one of the things that we have seen, and I know we'll get to it, has been a decline in participation. And so I have some concern, and I think that we need to better find out from those who have been here a lot. Is it a hiatus, is it like a sabbatical, or is it like a divorce? So I just have I think we need to find out more about that.
I think that's true, and let me tell you what I'm thinking, because I was the one who thought that, put it there. It wasn't an attempt, it was not an attempt to say, oh, everything's lovely and 1,000 people are coming each week. But at some level, the fact that we still have meetings that anybody attends after 4 years, I think is a testament to something, number one. And number two, what I've seen over the course of those 4 years is a lot of up and down in actual attendance at the meetings for a lot of different reasons. Some related to us and we were doing something or didn't have our act together as much as we should, or some related to community events or personal issues or whatever. But it has led me to think that the combination of those two things together, I personally, now this is different than the group, but I personally have moved away from this notion, especially in this new world that we're living in now, of defining a collaboration based on how many people are in the seats in front of you. Because all of those things happen, and we live in a world where you don't even have to be in the same room to collaborate. You don't have to be in the same country to collaborate through technology. And some of you know that's one of my interests in trying to bring to this process. Hasn't happened as much as I wanted to for very practical and real reasons. But I think in this whole notion of community-based research and work that we need to get away from that. Not entirely, but the notion of judging the efficacy of the relationship based on the number of people who attend a meeting is a less accurate predictor of what's going on or the meaningfulness or the integrity of the relationship than how many people are engaging, how many people are involved, how many people are, there are some people who can't, like, we have some high-level Hopkins leadership people that are very involved in what we do here. They don't attend these meetings. They won't attend these meetings. They'll come to 1 or 2 or 3 on a very special occasion, but I would never expect them to come to these routine meetings. Does that mean that's a weak relationship? I don't think so. But there are nuances like that that are tough. That's just where I think about it.
But I think it could be a sign to let you know that maybe something needs to change.
Sure.
I think when you do something for a specific amount of time, I think from time to time you have to add new ideas.
Absolutely.
New groups of people coming in, so new energy can function or whatever. And I think sometimes if it stays the same, people get tired, people get bored, people feel like, well, I know what it is, it doesn't really keeps me interested. And I've learned from my experiences that to maintain something going on, you have to be creative.
Absolutely.
You have to be thinking about what people would like to see. Maybe talk to people about what do you want to see, what would bring you in, bring new ideas, being bold. And all of those could be added to the project because I think if it stays the same, it just eventually dies because eventually people lose interest or whatever, and eventually you see less and less people, and that will impact the outcome.
No question about it. No question about it. So I want you to hold that thought right there. Start thinking about what we can do better to bring back either new people or some of those old people. But I want to discuss it when we get to that slide about what can we do better, because that's where that fits in. Because Angela's absolutely right.
I guess I don't quite understand totally what you mean by developing document processes.
Yeah, so that's what I was starting to talk about. So now I'm talking, I think, a little bit more from the Hopkins side. I've been here for over 20 years. And so I've seen a lot of these kinds of things, been involved in a lot of these kinds of things from the early days when I was in training to now. And what I have seen is also some peaks and valleys in terms of Hopkins community relationships and interactions. There was a time 15 or so years ago where there was a lot of money going into it and it looked like there was a lot of interaction between Hopkins and the community, and then that went away for a variety of reasons. And on the Hopkins side anyway, there was turnover in leadership, there was a whole bunch of things. And then there was a sense, maybe, I don't want to speak for people, but we don't really need the community to really do. I've actually heard people say, we don't actually need the community to do anything. We can put up clinics, we can do what we want, and we can be successful, and we're Hopkins. And we can still get a lot of money to do it. I mean, I've heard it. And so there was a moving away of this sort of notion that directly interfacing with community was necessary, needed, or beneficial. And then there was the other side of the coin where it was, look, why would I do that anyway? Because all I'm going to hear is their mouth about what the problems are. That's all I'm going to hear. Day and night. I've got things to do. Why do I want to just sit and hear problems? That was real. Like it or not, that was real. One of the things that I think we've been able to accomplish that has been one of my personal goals with trying to do this thing anyway is to put together a process that eventually becomes valued enough by community folk that they keep coming because they see some value from their perspective in interacting with Hopkins. and a process that Hopkins folk see as valuable for whatever reasons they see it as valuable. And I know on the Hopkins side, not everybody, not even a majority of people, but many of the people that we have interacted with see value in this process because it's a process where they can engage with people openly, honestly, and not feel like it's all just going to be slamming me in my face all day long, but they may get some of that, but real progress can be made, and it's important to the business that they do. And you tell me if you see it as valuable, but I think at least some community folks see it as valuable because they keep coming. You keep coming. So that's what I mean by a value process. What do you guys think? Is this process valuable to you for any reason?
Most of what you said was correct. A lot of the hospitals thinking is if they don't need you, they don't come.
Right.
They won't.
Right.
And once they finish with you, they're done.
Right.
So the hope is always that they will start to understand value in two populations as opposed to the single approach.
Yeah.
And I think one good thing about some of the government, federal government anyway, is they're starting to put in directives that indicate the same. You need to deal with the community so that you can solve some of these issues. And I think that's the only way it's going to really change, because you do have a lot of people in the hospital that are just skirt around the issues and won't address them. And one good thing about this process is that whether they are being solved, alleviated, they're at least being addressed to the point where people get a chance to verbalize them. And, you know, when you get dialogue started, it's an opportunity for change to come. But until that happens, you won't have change. It'll just be status quo.
Right, right.
And pretty much what he was saying, Angela was saying the other night, that, you know, people come to the table, but they don't be wasting their time. And especially when, you know, Hopkins come, they're being paid. Community come, they're not being paid. That's a legitimate concern, and it always has been. And a lot of the communities, I guess, apathy is based upon that. You know, why should I come and spend my time in there trying to get them to see PowerPoint when, you know, they're getting paid for it, I'm not. And I hear it all the time. So, you know, it's still a legitimate concern.
Yeah.
Around that first point, which is the one you're making, which is developed a value process, it should be more ongoing development of a valued process, because there is still room, and I think that's going to be on the improvement side again. But at least this way we know that it's in development. It's
right.
Because it sounds like it's been completed.
Well,
and
no. That's a very good point. Just because something's on this list doesn't mean it's done and over and we don't have to do anything.
Right.
I'm just saying, and I'm asking you if you believe we've accomplished something. But as Angelo has brought out in one respect, you're bringing out another. We still have a long way to go on some of those things and other things as well. But that doesn't change the fact that we've accomplished some things.
Right.
And that's the whole point.
And that's why I say that's ongoing, because what we have accomplished in that regard is the ability to, as Leon has pointed out, and Angelo has also alluded to, is that we have been provided with an opportunity to at least begin a dialogue, but in terms of how we get there, at least we know somebody will show up. Now, whether they'll listen is another process, which becomes important, because as we talk about an academic, community academic engagement, there must also be this interaction that occurs, and sometimes how that interaction occurs. So we can call it ongoing, which what we have accomplished at this point is the ongoing development of that process
That's right.
along the way here.
Can I guarantee you that everybody at Hopkins is listening to anything we say? Absolutely not. But can I guarantee you that some people and some key leadership people are listening? Absolutely. And they were not listening before this process started. I know that. So we've accomplished that. We're not done. We got a long way to go. But yeah. Hey, Deb. how you doing?
Hey, how are you?
You want to just quickly introduce yourself? We got a couple of people here.
Hi, Reverend Deborah Hickman, Sisters Together in Reaching, co-chair of the Community University Collaborating Committee for the Urban Health Institute.
So we're starting, as we've discussed, a process that's going to involve a lot of things and over a couple of days, and eventually, essentially, a self-evaluation process of what we're doing and where we would like to go. So we've been talking for a few minutes now about the things that we have seen, that we see, that we believe we've accomplished. Anybody else? Anything else? Anybody else wants to add before we move on? Again, this is not the only time you're going to talk about it. If you don't have it now, you think about it later, fine. That's good. Is anybody else? I'll go quickly back just one last time for those people who just got here. Can't do this backwards. So the things that at least some of us have thought are things that we have accomplished, not to say that we're done with it or there's no room for improvement, but things that we have accomplished in the last 4 years. Formed an enduring collaboration, agreed on a mission, agreed on some general operating principles as well as some core values, begun to establish mutual trust, decided on some priorities, started some working groups that have been working together now, developed the value process of community academic needs. That's what we were just talking about. Engaged community members directly with Hopkins leadership. That was not happening before this process started. Strengthened other collaborations, not this one only, but others. Initiated some projects, provided some real jobs to real people in the community, and more to come. And enhanced understanding. We've learned, I've heard from some of you, you've learned a lot about Hopkins. I've heard from Hopkins folks and they've learned a lot about people who live in East Baltimore. So at least these are some things, and Ernest and a few others added some other things that were not on this list. Any others people want to talk about before we move on? You can think of? All right, again, we'll come back to it. So, where are we now? What are we doing now? What's actually, those are things we've accomplished today. What are we doing now? Yeah, at least as I look at it, there are two things. Tell me what you think if there are other things. One is we're involved, as you said, in this community asset mapping project. At this very point, we've completed most, not all, of the interviews. We're hiring data coders. We're going to be coding and transfer, analyzing data, disseminating it, and then using it to advocate for change at the hospital as well as out here. And then we've begun to talk about this East Baltimore Health Opportunity Project, which has more to do with economic development, but that's many people's route to better health improvement, which is why it's a Health Opportunity Project. What we've begun to talk about there is neighborhood revitalization, CBO capacity building, skill development of people living in East Baltimore, as well as business startup support. And this came out of the Community Asset Mapping Project. When we're done with this, we're going to know a lot about what's in East Baltimore, the physical assets, the intellectual assets, and it blows me away how like I said, I've been at Hopkins a long time. They spend millions of dollars going all over the world looking for the brightest and best to bring here to train to then become tomorrow's leaders. I've always felt if they spent 1/10 of that money in their own backyard, they'd find some of the brightest and best that can go here. Well, you know what? We're going to be able to help them with that when we're done with this asset mapping project. And I just believe, I might be wrong and you'll have to prove me wrong, but I just believe that once we know more about the assets in East Baltimore, some of those skill sets, some of those people are people and skill sets that under the right conditions, if they want to, could form viable businesses. That could be the next leaders at different corporations and companies, or at Johns Hopkins, that the neighborhoods, the smaller neighborhoods that have been neglected could become places where business want to move into, thus providing a better opportunity for economic growth for the people who live in East Baltimore. And that's why we've become interested in this and starting to think about, well, who might be the right kind of partners to work with.
I'm real interested in seeing the outcomes of the data that was collected.
Yep, yep.
Because personally, I think it's going to miss the mark a little bit.
What do you mean?
I shared that before. A lot of the assets, I don't even, I talked to some people that weren't in touch, and they are assets. The man that runs the automobile repair shop, he's an asset. The man that used to own the shoemaker shop, he was an asset. You know, we have numbers of teachers that we were on. I was talking with Nia one day, and we were talking about some of the teachers, and none of them have been touched that I talked to. They're strong assets. They're retired teachers, some principals.
Yeah.
You know, they're strong assets.
Yeah.
And you know, if we're not reflecting that, the value of the community is being missed. Because when you do asset mapping, you want to show the strength that comes from within. If you look at the book we got from, what was his name, from
Jody Kringsman.
From Jody. Jody clearly stated in that book that the assets, you gotta beat the bushes and bring out the true assets, because all of that makes a big difference in the perceptions and everything that come from the asset mapping project. You know, it's going to get some, but, you know, could we get all of them? I don't know, but I don't know if we had the energy to put a concerted effort to get in all of the assets we could from this area.
Yeah, I mean, I think that's a valid concern. And one of the things I've thought about, look, we are constrained by the amount of money we have and the people we have. And when we're done, we probably will have talked to about 200 or so people. And that's clearly not everybody. That's clearly not even half of everybody, probably. But maybe, this ought to be a thing that is ongoing. You know, why should we stop now and never do this again? Maybe for that very reason, we should do it every year.
Okay, well,
and get another 200 or another 300 or whatever we can get the funding to do with people who weren't interviewed.
Well, that would be a question I would ask you, because you all said the asset mapper had concluded and you're now tallying data. So if this possibility that needs to be an ongoing process, then, you know, we have to do something different.
Well, yes, I mean, you missed a little bit, Leon. It's not totally concluded. It's mostly done for this round. We have to do some more. We have committed, we've always, from the very beginning, so this is not anything new or an add-on, to getting some interviews from the Latino community. So that's going to happen. But the reason it's mostly done now is because the money we have to spend is gone. And that's just sort of the reality. But my point is, if we believe it's something important to do, that we need to do more, then we collectively, Hopkins, all of us, we need to make it a priority to find ways to get the money to make that happen. And that's what I think may well be an important thing to do. Because you're right. I don't care if we talk to the 200 right people. Maybe it's more than 200 people we should talk to. Right?
I think then you can also do it in a bit more of a targeted way. I guess I sort of see this as something that's a bit more global. It gives you a
big picture.
Yeah.
And then you can, once you sort of know, okay, we have this, but we know that there are gaps here, here, and here, and you can sort of say, okay, let's target this, and you can take whatever resources you have, whatever resources you need to come, and use them
Yeah.
to that end.
I agree. So if we go, let's say we do again next year, then we can say, okay, we got this, so let's go over here where we were not able to get before.
Or look at the process, and ask yourselves, could it be done differently to make certain that we are hitting the key people in these various communities and that they're able to inform other community members, their neighbors and alike, that this is being done and that they might want to participate. For me, the key people that got missed in a major way were making certain that we had all of the neighborhood captains from all of the communities represented in the zip code areas that we were targeting, to make certain that they are the major influencers and they're the ones that are able to reach their neighbors and others, other assets in their community, to say this is taking place and it will be vital, because now we have a conversation that's going to start taking place about the East Baltimore health opportunity. One of the drawbacks is when we do mapping, and if we don't do it in a particular way where everybody's voice or everybody has knowledge and opportunity, then it lends itself to a lot of fractionation in communities. It pits one group against the other group. It brings up lots of things. And so I would say, really examine the process as to how it took place the first time and how it could take place the ongoing times to yield more and to be, my question for you, Chris, is the East Baltimore Health Opportunity Project. Who is the who behind that, and is the conversation in place at this hour?
So again, we, might speak for myself and Urban Health Institute, we are taking the same approach with that as we did with that, as we did with this whole thing. The we is us here, and we to bring it before you to discuss, and we decide collectively what's in, that's the whole reason we did an asset mapping.
So you're saying that this project, the East Baltimore Health Opportunity Project, comes out of the mapping, and that it's coming back to this body?
It has already started. We've already had discussions in this body about that. And it's not done. It's nowhere near. We haven't actually started doing anything here. But we have had conversations here about, does this seem like a good idea?
I must have been asleep on that though.
I'm trying to remember. You might not have been here that time. You might not have been here. But we've had actually right in this room, because we move around someplace. But right here, I think the first time was, I'm trying to remember if it was before Christmas or where. But I made it.
Meetings then. But so what you're saying is that some of the discussions that we've had about what could come as a result of the mapping are these things that we have talked about in the past, and it's now being formalized. Is that what I hear you saying?
It's not quite that much far along. I'm saying that we have initiate discussion and planning. We've begun to talk about these things. This is actually what I laid out to us as my original ideas that could come out of this.
Okay.
It was this that led me to think about this. And then I said, what do you guys think about it? Tell me, are we missing something? Should we go in a different direction? Should we stay there?
Should we interpret that what happens on the community access planning, what came out about, gives an idea of this could be created to address some of the findings that came out in mapping? Is that
Sure. It can go whatever way we want it to go. And again, we don't even have the data yet. We don't even have the data yet. These are just some ideas that it seems to me, I was like, man, after we do this, and we're going to have all of this, could at least feed into these things. And that's what we said. Tell me what you think.
Chris, comment. Two
Yep.
things. Those possible objectives underneath of that may be really pertinent to what's going on around here. Did the community decide them, or did you again introduce those to the community. Because if you remember when you first started this process a few years ago.
4 years ago.
Yeah, I clearly stated that everything that came up were the directives from you. You set up these different committees.
That's not true.
Why is it?
Here's what
If you got any minutes, if you look at some of those tapes, you'll hear the same thing each time.
No, you did say that, but I'm just saying it wasn't true that that's how it happened.
Oh, well,
Let me tell
somebody
you.
else wrote it. The community didn't have any input. That's my jest of it.
I mean, again, you're free to believe that, but that's not quite how it happened. What did happen,
Okay.
and what I always do, and what I always try to do, is to say, here's some ideas. Tell me your ideas. Tell me what you think about my ideas. If we don't like them and we don't want to do them, fine, throw them away. If we like them, okay, fine. Let's work with them and let's go forward.
That's not quite the way that went, Chris. I said in the meetings in initial stages, Michael Scott and myself probably on these tapes as saying that you came in and you had specific work groups, and the times were wrong for a lot of people because I couldn't even come to a lot of them.
But that's what I'm talking about, Leon, when we say, is this a good time, and you tell me no, then we change them. What do you want us to do, not do that?
That was not, but I'm just laying the groundwork that we can't go the same path that we went in the first part of it. If the community is gonna have input, then they need to sit in here and we need to ask them, what do you think we need? That's what we do in focus groups, to find out what they want. Have you asked Angelos what he thought would be pertinent for a follow-up to this initial part?
He's sitting next to you.
Did he ask you? Did you give him your input?
No, I'm just looking at what's in front of me. I can.
What's the answer? Yes or
No, but I can explain. I mean, you're having one conversation, I'm having a different conversation in my mind. It's looking at that and trying to make sense and trying to understand. I don't know what happened in the past, so I can't really talk about because I wasn't here. But I'm just trying to. I hear what you're saying, but because I wasn't here, I can't really say anything. Because, but I'm just looking at. I'm trying to focus on this and trying to make sense of it and see if it's something that could work or beneficial or whatever.
And again, I'm not even in disagreement with you, Leon. There's nothing that we have said here tonight that disagrees with doing that, nor that we shouldn't do that. We absolutely do that. We will continue to do that and must do more of it. And if anything on there is something that the community doesn't want to do, guess what? It goes away. But we can sit and talk about what happened years ago or last year, or we can talk about going forward. So, I mean, that's all we're here to do tonight, to sort of think about what we are doing now, what we have done, and what we want to do in the future. This is the process.
So is the Health Baltimore, the East Baltimore Health project a potential grant?
There's no money for anything right now.
Well, I get that.
And it's just an idea, just like the asset mapping was just an idea, just like this whole thing was an idea one day. That when we started, there was nothing but an idea. And we started talking. And as we started talking and formulating it, and people said, no, let's go this way, go that way, then somebody else said, well, I'll pay for that. And then somebody else pay. So there's no money, there's nothing there other than
I
ideas.
get there's no money, but
It could be a grant. Yes, absolutely. We could submit, and that, matter of fact, that's one of the things that has spun off. We've submitted, several grants from here and other spin-offs, the HES that Deb has been involved in, and other things. So yeah, absolutely, absolutely. Is there anything else going on now that we as a group are engaged in? Am I missing something, or should I take something off of this list?
Chris?
Yes.
I mean, I'm sorry, because I'm late, and maybe I'm coming in halfway
Yes.
here, but I think the issue and the important piece is that, and where I think you're headed, in terms of this East Baltimore Health Opportunity Project, is the idea that from the assessment,
Yes.
it leads to an action plan. and the action plan being talked about from a community perspective in terms of what are the issues, where do we go with this, validation in terms of from individuals, from us as we sit here and speak, etc. At least that's my idea of, and so it's hard to do, in my mind, it's hard to even respond to these until we have the data and have analyzed the data. Once we have that, then it really makes sense to think, okay, so what's this telling us as a group? And then where do we go from there?
Sure.
And my guess is that, and I may have missed one of these meetings too, that these may be just potential ideas in terms of where does an asset community assessment go? Well, it could potentially go in these directions, but the issue is to take the data, to look at it, to validate it, and then to come up with a plan from the, everyone's perspective.
Absolutely.
Is that-
We've talked about a couple of times now is not, and actually it came from this group, I can't remember who, but saying rather than just doing nothing until we have the data, let's begin thinking about where things possibly could go. That's precisely why we started talking about this. This is exactly why we started thinking about it. And it doesn't mean that's the only way, and it doesn't even mean it's the exact way it's going to go. But this is one possible way. There may be others. That's why we're bringing it up now. Ernest.
And I guess my thinking around all of those is literally that the asset mapping actually would go into two things that, and both have actually been mentioned at different times over these last couple of years. And unfortunately, they've never been mentioned. All of it has never been mentioned together. And that is that we have talked about the things that are going on, that are happening around East Baltimore, which happens to be many of the things that we see there. But the other side was around things that are needed, around the needs of East Baltimore. And those were primarily health needs. And then the asset mapping is this piece that was done so that we could make sure that we're identifying community assets of East Baltimore, known and unknown, and identifying them so that they could be then mobilized around moving towards those things. And so at this point, it was really, I guess, the identification, making sure that we are still talking about and identifying what is going on, what are the needs, so that we can, and as Joan pointed out, at the end of it all, there should be this action plan. There should be some actions occurring.
I think it should be action plans, plural, not just one.
There's plans, because we kind of know what most of them are. We just want to make sure that we now put them down, that this group can then begin to prioritize, because some of those needs, we can't hit all of them, but we can at least begin knowing which ones we can take down based upon the priorities that have been established by this group.
And I think, too, there are others that are going to emerge that we're not thinking about now that could even be bigger than some of the things that we're thinking about. I mean, Leon had mentioned some things. There are things happening in healthcare reform right now that make this project right here so important that you can't even I can't even fully imagine it. But, and somebody, Angela, one of you guys sort of alluded to that maybe part of the reason that Hopkins leadership is interested in this is not because they love us, but because healthcare reform is coming and this is the kind of stuff they need. I get it, and that's true for some of it, although there are some people that I think are genuinely the right people. But let me just give you one example about this. And I don't have the data yet, but I know what's happening, as Leon is saying, in terms of healthcare reform. Healthcare is moving, and Patty has tried to explain this, but I don't think in a way that really a lot of people understand. Is moving in the days gone past, a doctor would get paid for whatever he says he needs. I need this test, to get it, to get paid for it, or that. You need this, to get paid, to get paid. Those days are going away. And what is slowly replacing it in one form or another is the fact that I'll only get paid as a doctor if, at first, the patient in front of me actually gets better. But increasingly, that's not even where it's ending up. It's if this whole community is healthy. So as that day starts to come, doctors are terrified, many of them, of that day. Why? Because they recognize There's a whole bunch more stuff that needs to happen outside of a doctor's office. And a whole bunch of stuff that we need to understand about what patients do or don't do when they're not in front of us, that we need to influence in order to make sure the whole community, including those that may not actually see me, are healthy. And if you're going to base my payment on that, that scares me. Because in medical school, all I learned about is you when you're in front of me, and that's all that matters. And so they're beginning to think, I need to know what these people are living in and what they're doing, where are their assets that maybe somebody can work with together to make them better. Are there organizations in the community that are doing things that we don't do well, that they could do better, that we can send our patients to? We don't have that data, we don't have data systems, we don't know who those people are that are doing those things. So that's why this is important. And this could really help hospitals and places like Johns Hopkins totally change what they do and how they do it, not because they love you and they love East Baltimore, but because they want to get paid. But they can't even do it if they want to do it. I'm just being honest. Let's just be real. But they can't even do it.
Can I be real with you right now?
One second.
I mean, if we didn't do the asset mapping, visually, anywhere I have been in this immediate vicinity, 2120513 and the like, the blight is very, very visible. Affordable Care Act or no Affordable Care Act, if Hopkins is not going to become a builder of homes, which is health, all that other stuff, capacity building, skills development, is going to go to waste. The people in the community have excellent skills, but they lack hope because they can't get a decent night's sleep. They can't get a good bath. They can't get gas and electric. Those are the things, and we got 200 people, and you have how many people in these communities? And we keep doing the same things. If we go back through our data systems here at Hopkins and look at how many asset mappings have been done and what the information is, and we do a comparison.
There actually haven't been a lot of assets. There have been a lot of needs assessments, but not asset assessments.
Needs assessments, asset mapping, we can call it what we want. When we're talking to community, it becomes need, we make it what we want to make it.
That's true.
We make it what we want to make it.
Let me say this, Deb. You're preaching to the choir, but the reality is Hopkins don't care about that.
Hopkins has to care about it.
No, they don't have to care about it.
You're talking the Affordable Care Act, and you just said.
This is my point. That's
but my point is you did make a valid point.
That's
you were starting to make a valid point.
Yeah.
Health needs to be redefined because health is not health care.
But this is my point. And the only reason they care about that is because of reform. And without that, they will continue to do what they're doing and watch East Baltimore die.
They're going to continue to do.
But this is my
unless
point.
we as community do something
community,
different.
what power do people
Community has a lot of power once in power.
Once in power. That's
once
right.
in power.
Once in power.
And that's where I think that the greatest health opportunity
our
project
society
is.
works so hard to keep people disenfranchised. That's why. And so that's what I'm talking about. Through this
And
process,
I'm saying it's time for us to flip up their dress and make them aware. I'm sorry. I'm like, this is a conversation that is well past due. And no pun intended to you tonight. But something else has to happen. People are on the street day and night throughout these communities, and we're acting as if we're doing something brand new in the midst of human suffrage and in the midst of, I can't get out of my head, Mr. Chris's statement that with this institution sitting here in the middle, there should not, he said he won't see the community die, but I'm thinking that he might have been blind because the community has been dying all around.
That's exactly.
And it has to stop. And we have to stop doing some things of pitting one cultural group against another cultural group and not understanding the competencies that are necessary to bridge and to have power. Because when we do that, we take away power and we teach the community how to consistently take away power, that we need to empower them to knock on the door, to rally, the same way we have taken people to Washington, D.C. and downtown and whatnot. We need to begin to do something here that actually allows Hopkins, Billings Building, and all of the other buildings to feel the power and the shake of the community saying no more.
Well, I think
to do something different. And I know you might be getting saying, Red, please, hush.
No,
But I
no,
can't hush
I'm not
right
telling
now.
you to hush. I want you to talk. I want you to talk. That's why
No,
we're
don't
here.
do that one.
We are actually, we are in the same place in terms of goals, but maybe slightly different approaches. That's all right, but I think we need both, right? Where I sit, I think the days of marches are over. I think the days of, carrying banners down the street are over. That was the 60s. They were helpful to do that. And I'm not talking against it now if we need to do it for some reason. But now I'm talking about getting into the boardrooms and getting into what they need, not to beg for anything at all, to show value, to show that we had exactly what you're saying, but in a different way. You see, I know the things that now will be driving Johns Hopkins are over here. So now they're going to be looking for, okay, how do I solve this problem? They're going to have two choices. Go to the white boy who they can pay. I'm sorry for the language, but they can look at it that way. Or they can go to the community. But they're not going to just go to the community because the community is screaming, come to us. So that's our opportunity. That's our opportunity to show them the value that we have. And so that's what I really see we have the opportunity to do here. Not that I don't believe in other things in other ways, but I don't think we've done it, we, the community, have done enough of that. And that's
So
what
the
I want.
marches in the past were not really very solution oriented.
That's right.
Did not come with some
That's right.
things. I think that the marches can be effective, but we need to start with educating, informing, and readying the community that if you're going to knock on the door, you come with the facts and you come with the requests and the solutions. We can sit and talk, but we need the coffers to open, and we need people to begin to see something tangible that they can believe in again.
Yeah, I just don't think people, I don't care how much you talk, I just don't think people are in the business of opening the coffers because people say they need to be open.
No, I'm going to show you why. I'm going to show you how. I'm going to show you that you are not going to be the biggest insurance company in this city or this state if you don't do X, Y, and Z. And I'm going to show you why. I'm going to show you how we can do recruitment and the like. And then I need to go anyway.
No. I'm just looking. I wasn't trying to rush you. All right. We're in the same place, so it's okay. And let's, any other thoughts? Any other thoughts about what we're doing now? And are there other things that we not yet, we should. I mean, is there really anything else going on right now today with this group? I don't know of anything.
Just a comment. You
Yeah.
said the days of the banners and marching is over.
I think that, for me, this is just me personally, I think the days, of accomplishing a lot with that, I don't see a lot of value.
You see Hopkins in December when Reverend Williams brought 250-some people down there.
No, I'm not saying
You
we
see
shouldn't
outcomes.
never do them.
He got the funding he wanted for his clinic.
Yeah. Well, see, again, the level I live on,
They didn't say
where I live on, those are small successes. Funding a little clinic here, funding a little clinic there. They've been throwing us bones and making us happy for long enough. We need to change systems. We need to change the way things work, and that's not going to happen by a little march. That's what I'm talking about.
I think that what you're saying is correct in the sense that a march, a demonstration might accomplish a specific, very small
That's right,
goal,
and it might be an
but
important
it might
thing.
be just for that specific
That's right.
time. I
That's
really
right.
think focusing on systems and what you were talking about, I truly believe in our community. When we're going to talk to Hopkins and some other people, we are saying we want to get paid. Because we bring something
So
of
value, exactly.
So we're
Nobody
not
pays
just
anybody
saying
for
to
nothing. That's
Hopkins or
right.
somebody else,
That's exactly
give me
right.
something, but what
That's right.
we're saying is, we are bringing something that you can benefit.
That's right.
And
That's
I think
exactly right.
in some of our communities, we need to start looking at that.
That's exactly
and
right.
unite some form of way where when we come to the conversation table, we have something that more just.
Well, let me tell you.
I think we're saying the same thing. We are saying the same thing.
Yeah.
It's a matter about, when Leon says about the marches, when we talk about the marches in the past, we held signs and whatnot, but where we coordinated to the extent, I'll use Obama's campaign for an example.
Right.
The extent where we make the measurable difference because we have all of the facts
Right.
and we understand what is the need and we understand how to request it and how to demonstrate the outcome from the process.
Right. And I think, as just the last thing, this process, this thing that we've been doing for 4 years, is something that at least some of them see as value, that they are now. And when they see value, then coffers open. Much more readily when they open, they say, because you're the bad person, you haven't been doing it, do it. Even if that's true. Because the coffers are opening. Patty is at this table. Patty's talking about supporting this thing, and nobody's forcing her to do it. She sees value in it, and that's why this thing is important. Yeah.
I agree with you to a certain extent, but I think part of that push for why you see certain individuals coming is funding.
Of course.
And it's the fact that if you want to get certain types of funding, you are now required.
Guess what?
To have
that's part of our value.
Right, so that's where the
That's
value.
exactly what I'm saying.
And it's not
That's part of our
that's
value.
the value.
But we have to recognize that and package it in a way that says, here's our value. If all we can do is scream and shout about how much you're the problem, that funding is never coming to us. It's coming to the one that they can sit down and talk to and have a civil dialogue with. You can fool yourself if you want to. But that's part of the value. All right, Ernest.
And just to, because Leon gave a very good example to what both Angelo and Reverend Hickman was talking about. And that Reverend Williams, when he went out, and he was out there on Broadway, he was out there for a very specific purpose.
That's right.
With a targeted, he had a targeted outcome.
And it comes.
He was not out there
That's right.
howling, but he was out there
That's right.
for that. And he wanted to have this clinic funded.
That's right.
That it brought, it valued healthcare in East Baltimore. That it literally, and interestingly, would keep a lot of the very people that they were trying not to, so they are now talking about this emergency room thing, help keep a lot of those people out of their emergency room and who were been Medicare, Medicaid patients, and this center and this clinic helps to reduce that. And so now, is it cheaper to fund this clinic or to continue knowing that these people, if they aren't in this clinic, may impact what it is we're trying to do?
Well, do what he said. He said either you fund them now, or we're gonna send everybody to the emergency room every night until it's over.
And that's what. But again, therein lies the value. That there was a purpose and there's a value there. And that's what we've got to do. But also, one of the things that, and Tanika also hit this one, is as we go in and as we talk about this, as someone, because we know they want funding, or that someone will come here for funding, one of the things that we have also got to think about is how are we going to be engaging these individuals? And understand what I mean by that, because I love it when people say, well, the literature says this, and I hear this out of a lot of Hopkins people. And one of the things that I ask for is access, just because I try to explain to people I am a researcher and I do a lot of it. And one of the things that the literature, on film, says is that when it comes down to these community engaged research projects, where you want to do community-based participatory research, they should actually, in order to maintain a sharing of power, allow for somehow or another, bring about the co-PI from a community person. Because this person, since you need that person to help you in there, you might as well help bring them onto this project from the beginning in the capacity of to share in the decision-making, in the planning, and in its implementation. So that there is a fairness. Now we now begin to create a fairness across it. So as we talk about opportunities and projects and things like that and partners, we also need to think about what are the opportunities where individuals, Reverend Hickman, nationally known, internationally as a matter of fact, in terms of research, can be a co-PI to some of these projects. Leon, Angelos.
Everybody.
There are opportunities there, but we've got to allow out, that recognition has to happen from the day that someone begins saying, you know what, I need to do a project and I want to do it with the community.
Well,
exists.
Come to the nuts and bolts thing. When we talk about participatory research.
Well, I'll be there.
I'm presenting.
I'll give you a little something. Oh, all right. I won't
So,
throw rocks
again, I
in there.
think we're all on the same page. We're talking about two different levels here. One is sort of here and one is here, but we're all at the same level. And don't quote me as saying I think marches are of no value. I just think they're of different value than what for me, the real change is at the system, and not at the clinic level or even the individual person. All right. So anything else? I think there's nothing else that we're actually working on, so we can go. We just have about 10 more minutes. Let's finish up on this.
Where do we go now?
We're going to get there. You missed the first part of this. We sort of laid out, there's several questions we want to talk about, where we've been, what we're doing now, what we do well, what we don't do well, and what we need to improve. How do we better track what we're doing and evaluate what we're doing? How much is it costing us? How can we do better on that? And ultimately, where do we want to go in the future? And so we're going to get there, but there's actually some things that I think should come before that. So we have, and we're not going to finish it tonight. We never planned to finish it tonight. So the next All Partners meeting will continue this. We're going to be doing several things to talk to you and as others about these kinds of things as a way of evaluating ourselves. So here again, just some ideas, some things that we thought of. Tell us what you think about what this group, does well. I think we are composed of very dedicated and committed people. That, I think, is an important trait that we do well. Look, it's gotten us to 4 years. It's gotten us to 4 years. I'm telling you, most of these collaborators do not last 4 years. I think another thing we do well is the diversity that we have in here. We have all kinds of diversity in here. We have racial and ethnical diversity, economic, people at higher income levels and lower, educationally, religiously. I mean, there probably are other ways we're different, but it's in our differences that we learn about each other and the needs of others and how we can work together, as was it Deb or somebody was saying, instead of trying to separate us and pit one against each other, how do we all work together to accomplish common goals? I think that's something we do well. We all know there are groups where if you're not in that group, you're pushed out. You're just not considered part of the group for a variety of reasons. Sometimes we think that's okay. Sometimes we think it's bad. I think it's always bad. I don't care whether it happens at a community meeting like this or a church room. I think it's bad. That's my personal view. But I think diversity is good, and I think that's something we do well. I think we're full of very experienced people, very experienced in many different ways, and we're not green. We're not green at East Baltimore urban life. This is not a bunch of people who live somewhere else and work somewhere else, never lived or worked here or places like this, talking about trying to fix it. We got people who live here, who work here, who know about urban life that are doing it. They work here. We have experienced researchers here and clinicians as well, healthcare providers who work in this environment. That's important, I think, in trying to think about. We got people who do well in advocacy and policy at the city level, the state level, and the federal level. These are strengths. These are things we do well, I believe. But yet I've seen us be flexible. And at least in my opinion, flexibility is an asset, is a trait that I think is good. And one example I have there is J-CHIP. And those of you who are around know what I'm talking to. So this is the $20 million grant that Hopkins got to do innovation in healthcare. But they needed the community input, and they came to us to be involved. One, because they saw value in the process, first of all, because they could have gone anywhere else. But when they came, the grant was already written, basically. But not basically, it was written. It was written.
Quite done.
Well, it actually was done, but they were open to modifying it. But it actually had already been written. But they were open to modifying it, which was the good thing. And they knew they would have opportunity if it was funded to modify it. And we could have said in the beginning, sorry, you didn't come to us because of our principles of being there at the beginning and working it all the way through. And there was some discussion about that. Some people thought we should. But eventually we said, you know what, this is not perfect, but we recognize it could potentially be an opportunity to stay engaged with the leadership and make some change. And we decided to stick with the process. We're not going to do that with everybody or anybody else. But we decided we were flexible.
They went back to what you said earlier.
But
They came because they needed.
That's right.
community.
That's right. That's exactly right.
The only reason they were open to modify.
It might have been, but I can tell you this, if the process wasn't here, they'd have gone to someone else and it wouldn't have been us that had benefited. And that's my whole point. We have something in this room that they see as valuable, and that should not be undersold or underplayed because it is valuable. They would have never come here if it wasn't. And then finally, the thing that I think is valued, we can disagree, and disagree passionately, but we're still respectful and we have civil dialogue. You and I both know that in some groups, it's hard to talk about these things. I mean, all you gotta do is look at on TV and look at the Tea Party. I'm sorry, I shouldn't have said it, right? Okay, I said it. But it's the truth. It's just the truth. But I think in this group, we can talk about the toughest of tough and the hardest of hard. And I'm hoping that none of you become my enemies because I'm, passionate about some things, and I'm not your enemy because you may differ with me or you're equally passionate about some things. But I think those are things we do well. What do you guys think? Do you agree, disagree? Do you think there are other things that I didn't talk about that we do well? Is there anything you think we do well? Nothing? It's not sure. What do you think?
What do you do well?
Not me, the group. The group. It's us. It's us. We are forcing ourselves to look at us, not just one part of us, all of us.
I think we bear the truth very well in these meetings. We bring reality to the situation, and we look for a response, and we demand, and we're starting to demand now accountability.
Accountability of ourselves or
ourselves as well as Hopkins, and that we are actually bridge builders. We are working on becoming bridge builders.
So I think that's a key, becoming bridge builders. Because you can demand all you want, that doesn't necessarily change anything. It sometimes does. It definitely sometimes does. But I think, as the saying goes, you can get more done with honey than you can with a stick.
Be careful with the honey, though, because if there's no demand in the honey, nothing gets done.
Of course,
and when I say demand, I mean, being very diplomatic.
Sure,
but at the same time, because everyone demands something from someone, but it is your diplomacy that actually carries you over into getting what
Absolutely. And I can tell you, I know it. I've sat through it in days gone by when there have been other groups trying to have dialogue with Hopkins officials, and it's just been screaming and shouting. It has shut the door down, and nothing is. I've even been, I'll give you an example. I'm not going to tell you who or what, but I know of a situation when Hopkins was going to fund a community organization to a significant degree, and internally there was discussions, and the party that was going to fund it said, I think we're going to give this organization right here in East Baltimore something, and the other person sitting in the room, such and such is the leader of that organization. Yeah. Well, that person is XYZ. I don't think you should fund it. Done deal. Absolutely done deal. That's a self-inflicted wound.
Right.
And I think it's important for us to recognize that and to get rid of that because it doesn't help.
Diplomacy matters. You
It
can
does
get
not
up on the
help us.
tabletop and dance all you want.
That's
After
right.
a while, you just have
That's right.
rhetoric.
That's right.
And
That's right.
nobody's listening.
So we're not talking black and whites here. We're talking, absolutely. Anybody else? Things we do well? Things you think we do well? We believe we've done well? I mean, I really think these are important things. I don't think these are just fluff things. I think these are really important things. And they, at the end of the day, really make the difference as to why people see value in us. Because let's be honest, as I think Deb was alluding to, I mean, the problems in East Baltimore, they're known. It's not like people don't know, right? But it's the process of how do we get to change. Anybody else? Any ideas? All right, let's see. This will be the same thing. Well, let's end on the next one, and then we'll review again last week. We have about 10 minutes. All right. So what do we need to improve? Because we have a lot of things we need to improve, I think, and I think some of you would agree. Just because we've accomplished some things doesn't mean we've accomplished everything. These are some things that I've thought about, but I know Angelo particularly started to talk about one, and others can talk about others. We need to build more awareness about what we're doing. A few people know about us, but not everybody, not enough. They've never heard of this in the community, some people and at Hopkins. We need to go beyond East Baltimore. It's not just, I mean, in terms of awareness, this is a model. This is a model that already, actually, because of the filming and the streaming that we are doing, we have had inquiries from around the country about how do we do this, from other people in other cities in America, I think Detroit or somewhere else, about how to do this. So we're not even doing anything to try to foster that, really.
Who responds to them?
You know what, we haven't really been tracking it, so I mean, maybe sometimes nobody, maybe, I don't know. I don't even have a good sense of how many we've gotten. I know I've gotten a couple to my email about it, and I think there are, the other reason, I think Liz was telling me some time ago, you can actually check who's looking at your website through Google Analytics and where they're coming from and things like that. So we know people from other places are looking, and we've had some formal invitation, formal discussions about it. But we need to be more intentional about that. We need to be more intentional about documenting what we're doing, telling people what the good or the bad or the hard or the easy or how to do it. Just showing other people how to, look, man, we've worked this out. We struggled with it for 4 years. Now we got something. We need to be intentional about it. Maybe there's application for this on the international scene, even outside of America. I don't know. Maybe. Maybe not. There's certainly opportunity in the scientific literature, as Ernest was talking about, and the asset mapping project, but even just the process, there's opportunities there. We need to do more on those lines. We need to involve more, it's getting to Angelo and some of the other, we need to involve more people, more different groups in the process. There's some groups that have not been here, some people that have not been here. They need to be here. We need to measure and evaluate and track what we're doing better. We've started, we'll come back to these things, but we need to do it better. We need to get some more funding. And I have one slide on here about what we've spent already. But let's face it, the money that we've had to do what we do, even in places like being in here, you know, every time we meet in here, we have to pay money for this place. Every single time. The food, the lights. So we gotta at least start thinking about what is it that we can do, if anything, to get more money. You know, Urban Health Institute only has a certain amount of money. I believe this is the bottom line. We're doing all of this because we want to improve the well-being of East Baltimore residents. That's the whole reason. We need to hopefully do things that do it for more residents. We've done a little bit, I think. And if nothing else, you know, I'm not even just talking sort of the soft things, oh, people are more educated, or more capacity, those are good things. But as I alluded to earlier, we've provided some real jobs for some people in East Baltimore. Now, in my mind, they're not full-time, they're not permanent jobs, so that's a problem, but at least they were temporary. They got real cash for them. And in the past, that would have gone to Hopkins students. So that's a good thing, but we need to do more, man. And we need to empower you to do the things you want to do that maybe are not, you know, a part of what we do here, but because you're a part of this group, you can do better what you're doing in your places. That's what I call spin-off goal. I think that's all I have for that one. Angela, why don't you go back and start talking about what you were talking about earlier? Other things that we need to improve.
So my comment was that when I came to the last meeting and I saw what was accomplished, the fact that the entire community was missed, was very disappointing. But as we look forward towards the future, we need to understand that if we want to bring other communities, we need to change the way we do things and how we do what we do. Something that I see missing is cultural sensitivity and cultural understanding of different people that come to play. The system was created and then we realized, oh, we got a big hole here. How do we cover this hole? And I think that.
And Angela's talking specifically at the fact that we really have had, until he came, no Latino presence. It wasn't because of not trying, but we weren't doing the right things, whatever.
But to me, the fact that it was missing, it shows me there's issues that need to be addressed at some level, because you knew that those that community was missing, and maybe you tried to bring them in, but you were not successful. So there was something missing there. And I think that to look towards the future, we need to take a look and see what else is there missing that might be preventing other people from coming in, or from people who are here that stop coming.
Yep.
Because it goes together, it's not always for us. So that's just, culture and linguistically understanding culture is, because sometimes we look at communities, black and white, rich and poor, or whatever, but there are many other different communities.
Absolutely.
Talking about the Latino community, it's a very large community that is growing, that has unique assets and values and needs. And sometimes when a system has been pretty much black and white, English speaking, it's very difficult to bring somebody else that doesn't fit inside of those components. So to change that and to open up for other people, I think is a challenge.
It certainly is a challenge. It's why we failed so far, right?
And
But
to recognize is that we do something different.
Yep. And I think, maybe we'll be so blessed to one day have the opposite problem today. There are hundreds of communities, hundreds of ethnicities, can we involve them all? Representatives even, if not everybody. I mean, Leon brought up at the meeting we had yesterday in the other group about, the Lumbee Indians. There's a sizable Lumbee Indian population in East Baltimore, and they're disenfranchised for a number of reasons. Number one, they're not recognized as one of the official Indian populations that can get government assistance. So they're real Indians, but they don't benefit in the same way other small populations.
Actually, because I was actually on a bus and we started talking, me and this guy, and he's a Lumbee Indian. And I think they just...
Oh, they might have just got it. I don't know.
It's like in the last month.
Is that right?
It's like just recently, just got recognized as a formal tribe. And I think it's only for the state of Maryland. I don't even know if they have a national designation yet, but he was saying that his tribe is finally being recognized. I was down here on Broadway, we were on the Green route, coming back over this way.
So, I mean, it's not our problem now, but it'd be great if it was our problem. Should we even try to get we got Somali, whatever.
I think, Chris, that it is very vitally important that we bring back all of the communities to the table.
Yeah.
Because in East Baltimore has had and still has its uniqueness of communities and culture.
Sure.
And communities and cultures that don't speak with each other, don't acknowledge or sometimes respect each other's.
Right.
And I think, I'm blanking on his name that did the book Not in My Neighborhood. Maybe it is...
Arturo.
Yes, Antero. And so, we really need to look back, and some of our communities that are new to the community need to understand Antero's, book and the history behind it, because it's playing itself out again. And so, because the richness of the Greeks, the Polish, and all in this community, working together and understanding not to allow the same racism to occur again, because racism we don't want to talk about, but it is very painful, it's very present, and we do need to talk about it. We need to talk about it in the face of when Angelo says black and white. There is so much black pain, black blight, and so much anguish in this community that there is no way that any group maybe can understand why African Americans would stand up and feel very dismissed without their problems being addressed adequately in the midst of growing other communities, because they've been so displaced, because this became their home as a result of Not in My Neighborhood. And so I think that there's a lot that we can start to do there to build our relationships, our understanding, and our competencies to do better.
No, I agree. I just bring out, at some point that's going to be a challenge of how we do that, but let's have that problem, right? Anybody else? We've kind of run out of time. We're going to continue this, but anybody else want a thought about what are things this process really needs to improve? Think about how we can improve as we go forward.
Chris?
Oh, sorry, Joan,
I
yes.
think building on all of that too is, and just to summarize the way that I sort of see it too, is it's our overall process. And so the process in terms of even, we went along and we did our best at the time, but the issue is identifying the neighborhood associations and the leaders within those groups, pulling them in more. I know that's something that we talked about all along the way. I'm not so sure it happened.
So being more intentional about
Yeah.
who we go after, not just sort of
Well,
everybody's welcome.
To be, that's right, and to be
Yeah.
inclusive and to truly engage neighborhoods, neighbors, et cetera, through that process, I
Yeah,
think would be
yeah.
one way of doing that. And
Yep.
I don't think we've done
No.
yeah.
No.
Right, and I want to take a step back to something Leon said too, as it was related to the asset mapping around, and I think someone else in the room talked about it around the asset mapping study and around pursuing or engaging community leaderships, association leaderships, because that's one of the things that was, we worked on identifying and putting out there. And I think what we also had to do around that is, as Jonas pointed out and as others have said, is try to make sure that this thing, because many know about it, but don't know what it is we're doing or why it is we're doing this. And I think making sure that people have that understanding. You know, are we clear? And is it clear about who we are, what we're doing, while we're doing it?
No, I think you're right.
I think it's not necessarily a weakness, but I think sort of moving forward and thinking about particularly point two, and also this idea of measuring, evaluating, and attracting funding. The process of this, and how we go about evaluating the process, is going to be incredibly important, particularly in thinking about how others will choose to move forward with projects such as this. Because those are the things that really make a difference. What are the lessons that you learned? What are the challenges that you encountered? What did you do with those things? How did you bring people together? And I think that's going to be very important, and those are things that can be worked on.
Yeah, I agree. I mean, I really believe, particularly for those of you who have been here from the very beginning, and a few of you have Leon, and a few others have been here from the very beginning. You know what? You got 4 years worth of being beat up and listening to me now. You got 4 years worth of experience that now makes you an expert in this process, right? And to the extent that others may want to do this process, you are and should be recognized as a leader in this process. So when they look for people to want to come teach them and help them learn and understand, why couldn't it be you? Any of you, not just me or others, it could be you too. And I think, you know, we will talk more about that later, but I think the first step is that you thinking of yourself that way. I mean, really, there's no reason why it shouldn't be that way. There's no reason why it shouldn't be that way. We've run out of...
I'll just make a brief point. I think as the successes of the initiative get shared, and maybe someone said this before I got here, I apologize for being so late. I think it's also just important to think about what kind of constraints get put on the process by something as simple as it, being based in an academic, center. Something like asset mapping, which is a really well-founded community organizing tool. You look at other places where that's done well. It's a project that's implemented over a course of weeks to months, not years, and so it's much easier to put into practice. And just something like having to go through the IRB, having to hire through hospital HR and that kind of stuff. As we think about moving towards for the future, how to build this kind of capacity, but outside of those limitations, I think is important.
We're going to end this whole process, but where do we go from now? I mean, how do we go forward? But that's, I think, you're absolutely right. Thank you all for coming. I think this was a great discussion. We will be continuing it next time and doing some other things. So keep thinking about these things and let's make us better. Thanks a lot, guys.
Next meeting will be April 25th.
April 25th. Mark your calendars, spread the word. April 25th, is it here? Is it going to be here, Liz?
I don't know, ask me.
We're not sure yet of the place, we'll let you know, but...
no, that's...
April 25th, we want to do some
That's
more on
3
this
weeks
thinking.
3 weeks from today.
Same week as the social determinants of health.
Oh.